Welcome to today's webinar, Mixed Methods Feasibility Study of Group Peer Support Interventions to Engage the Public in Advanced Care Planning. I will just go through a few housekeeping items before we start today's presentation. We usually have 15 to 20 minutes at the end of the presentation for a Q&A, so if you could, please submit your questions online during the presentation. I think today's presentation is about 35 to 40 minutes, and we will try to answer as many questions as we can before the end of the hour. At the end of the survey, we hope that you will take the time to provide feedback. A survey will pop up on your screen after the webinar, and it's an opportunity to provide feedback to us in terms of future webinars. And it also would be helpful to provide information to the presenter. And we're also looking for ideas on new hot topics, which I'll speak to in a moment. You will see that the webinar slides and the video will be available on our website within the next 24 to 48 hours. And you'll see the URL right now. So for the first time, we have a new webinar series, and we're calling it basically CFN Frailty Hot Topics. And these are more designed for general audiences, including citizens and clinicians. And this first one that we're doing is influenza vaccination, which is a really hot topic around this time. And the registration link is below. So we would appreciate if you could send this registration link to anyone who you think would be interested, because we think this is going to be a really good educational webinar for everyone. Our usual webinars are about an hour. This one is potentially an hour and a half. You would have the opportunity to leave at any time if you didn't want to stay for Q&A. We also have some research webinars that are coming up. One is November 7th and one is November 21st. And I think I forgot to say when the hot topic webinar is, which is Thursday, September 27th. So that's in 2 weeks from now. And of course, next week is our annual conference. And this year we've added something different. We've added an innovation showcase on the first day. So the Thursday, September 20th in the afternoon will be a showcase. We did have 79 applicants to this innovation showcase, and the top 30 innovators will be at the showcase where you can ask questions. So we're hoping that you take the time to drop in if you're in Toronto, and to register if you would like to attend this conference. And again, the conference website you'll see on the screen. So I'd like, after all of that information, to introduce you to our two presenters today. We have Doris Barwich, who's the Executive Director for the BC Centre for Palliative Care, a clinical associate professor at the University of British Columbia, and is the co-chair of the Provincial Palliative Care Advisory Committee. We also have Iman Hassan. Both of them will be presenting today. She is the Director of Public Health Initiatives at the BC Centre for Palliative Care, and she leads its Advanced Care Planning and Compassionate Communities initiatives, and has more than 15 years of experience leading the implementation and evaluation of population health and community-based initiatives. So I will now pass this over to Doris to start the presentation.
So has everybody got my screen up?
Yeah, I can see it. It might need to just be maximized a bit.
Yeah, okay. All right, there we go. So thank you, Carol, for that introduction, and thank you for this opportunity for us to share the results of a CFN Catalyst grant that we did a number of years ago, and to tell you a little bit about some of the background, what happened during the study, and just what we've done with the information since then. So the study itself was a mixed methods feasibility study of peer support interventions to engage the public in advanced care planning. We worked with quite a large group of people. So myself, Jennifer Kravruchko, and Armine Kasanjian, who are both on the line, were principal investigators, along with many other investigators, quite a large research team, a working group, which you'll hear more about later, and then the various hospice societies and senior centers that worked with us to basically test a new intervention in the public space to assess its feasibility and acceptability. So just a little bit about the center. We're a center of excellence that was established in 2014 to establish excellence in compassionate person-centered care for everyone affected by serious illness. And we basically have two main focuses. One is the public, to create more awareness, engagement in advanced care planning, palliative care topics, and also a compassionate communities initiative, as well as working with the health system and healthcare professionals, and to kind of mind the space between them. So when we're seeing gaps on one side or the other, we're trying to fill those gaps or bring people together in innovative ways to develop new approaches to care for serious illness. And advanced care planning is certainly one of our key strategies. And we embrace this newer definition from Rebecca Sidori, which basically says that advanced care planning is not just about end-of-life care. Advanced care planning is to equip and engage the public in being more involved in healthcare decision-making throughout a journey of serious illness. So it's really a process where we create a space where people can think about and begin to share their values, beliefs, and wishes, which then, in discussions with healthcare providers, informs healthcare decision-making, and then ultimately, ideally, to get person-centered care, goal-concordant care, care that's right for that person at that time and is aligned with their goals and values. So it's really not about end-of-life care, but it is about this whole journey of frailty or chronic illness in which there's constant intersection with the healthcare system and decision-making related to that. And certainly our goal with these community-based sessions overall was aligned with that in terms of increasing advanced care planning or ACP engagement and awareness. And we talk about more, better, earlier conversations. We borrowed that from Ariadne Labs, which leads the serious illness initiative worldwide. And just this idea that the earlier we're having these conversations, the more conversations occur throughout the trajectory of illness, and eventually a focus on the quality of the conversations. That is a key enabler for the right kind of care. Our objectives in this study was to increase public knowledge, awareness, and engagement, and also to increase the engagement of community. And do this by focusing on public education, by building a toolkit of resources, by actually assessing the feasibility and acceptability of education delivered by peer facilitators, hospice volunteers, and others who work within community-based organizations to roll this out. And for the initial rollout, we were giving between $3,000 to $5,000 to various organizations through our seed grant program. That program has now ended, and you'll hear about that at the end. But basically to just help people participate and basically take on a kind of a new way of being in the world. Particularly we have over 75 hospice societies in British Columbia and most of the small communities and larger communities throughout BC. And they had identified advanced care planning as a key strategic priority, but they really lack the how-to of how to do that. And even those that had been delivering it for a while did not have the capacity to evaluate what they were doing or to improve it based on feedback. So the purpose of this study was really to develop, co-develop with community-based programs and implement and then evaluate feasibility and acceptability of community-based, peer-facilitated advanced care planning session for frail older adults, their caregivers, and their families. And to ask, what is the impact of the intervention on their ability, defined mostly as knowledge and confidence to deliver these sessions, and did it work? Was it efficacious? Did participants, after attending the workshop, have increased knowledge, awareness? Did they change anything in terms of their attitude towards or their readiness to engage in advanced care planning activities? And then we also did some qualitative work with interviews and focus groups asking peer facilitators, what was that like? Having gone out there and delivered these sessions, what was your experience? And what was the experience of the community organizations? Because if you can think about it, to deliver a session in the public, there's marketing, there's hosting on the evening, there's a lot of other people involved beyond the facilitator. And was this just a lot of work without very much benefit, or was it something that actually benefited the community organizations? And the data we collected was through both questionnaires, focus groups, both pre-workshop, post-workshop, and then with the participants, we were able to contact quite a large number of them afterwards and do a follow-up questionnaire just to see if there were sort of things they said that they would intend to do right after the session. What was it like for them 4 to 6 weeks later? Had the interest dropped off, or was it increasing or getting worse? So I'm just going to hand it over to Iman Hassan, who worked closely with the working group to develop this intervention, and then also was very involved in the evaluation of it. Iman?
Thank you so much, Doris. Matt, are you going to share the screen now? Yeah, okay, thank you. Okay. Okay, so do you see my screen now?
Yes.
Okay, wonderful. So I will talk about, I'll just give you an overview of the development of the model. In this picture, you see that the volunteers from 2 community organizations that we worked with to develop the peer-facilitated ACP sessions model. The Community Engagement Advisory Network, that's part of the Vancouver Coastal Health Authority, as well as the Comox Valley Hospice Societies. The 2 groups, we knew that these 2 groups were offering ACP sessions for the public for more than 5 years. And so we met with them to better understand the model that they use, and see if we can work together to come up with a feasible model that we can that other organizations can adopt, and we help the spread of this model across the province. We worked with them to develop the model that includes 5 key components. Training for community volunteers to become peer facilitators for advanced care planning sessions. And the training requires completing an online training module for basic ACP sessions and attending a full-day in-person training workshop. It also includes organization resources for the participating organization that will host the sessions in the communities. It includes the organization resources basically help them to host and evaluate the sessions. Resources for the trained facilitators in the form of a facilitator guide and a large number of a variety of videos and stories and pictures and photos and personal stories that they can use during the sessions to engage the participants in the conversation. We didn't forget the participants. We developed resources for the public participants to take away after the sessions to learn more about the advanced care the process and the steps that they need to follow to complete their advanced care planning. And also we provided them with links to the forms that they might need to record their wishes. The 5th component of the model is coaching and mentoring by a community development specialist, as well as access to experts in advanced care planning. In this slide, you see some examples from the tools that we developed. On the left, you see the facilitator guide, and on the right is the program implementation guide that the organizations use. And in the middle, you see the public handout. I'll tell you a little bit more about the ACP session, the structure of the ACP session. The 2-hour session is designed to support the participants to engage in advanced care planning by providing them information about the importance of having a timely ACP, before a crisis happens, and guiding them through the steps involved in this process. Two of the important attributes of the sessions are interactivity and conversations. The facilitators often start with a positive or a negative story to explain the importance and the benefits of advanced care planning, then invite the participants to share their own personal experience with that if they have one. The facilitators, we encourage them in the facilitator guide to use a lot of visual aids like videos and photos, as we said, as engagement tools. The structure of the session is not rigid. The facilitators know that they can adapt the conversations and the flow of information to meet the needs of the audience. This is a schematic that we developed for the facilitators to use during the session as a reference. It basically reminds them of the important steps that they need to follow and the topics that should be covered during the session. Now about the implementation. It's very interesting, and we learned a lot from the organization that participated in that adopted the model, and we call them early adopters. As Doris said, the implementation of the model was facilitated by seed grants opportunities announced by the BC Center for Palliative Care in the spring of 2016. The center basically invited community organizations to adopt and implement the model in the community and receive a one-time grant of $3,000 as a seed money. In addition to the seed money, the funding, the BC Center provided the access to the community development specialists as well as the experts in advanced care planning. The early adopters were invited to participate in the research. 9 community organizations, mostly hospice societies, decided to receive the grant and decided to implement the model. And 8 of these organizations agreed to participate in the research. From May 2016 to January 2017, we had 2 training workshops through which 54 volunteers were trained. And the 9 community organizations during this period hosted 23 peer-facilitated advanced care planning sessions to the public. In these sessions, 266 public participants attended, and 217 completed the questionnaires at the end of the session, and 60 public participants were interviewed 4 to 6 weeks after the date of the session they attended. This is a picture from the training workshop that we had in Prince George. The training is full of small and large group discussions and skills practice and role playing to help the volunteers develop the required knowledge and skills to become peer facilitators. Now let's have a look at the evaluation, the results from the evaluation, and I will start with the peer facilitators data. The trained volunteers were mostly highly educated females at the age of around, the average age was 50 years old, and most of the volunteers had previous facilitation experience. However, much fewer had experience in advanced care planning facilitation. Around 3/4 had healthcare experience and 18% had teaching experience. We asked the volunteers before the training about their own experience or their own engagement, personal engagement in advanced care planning. And the data showed that they have different levels of engagement different level of engagement in advanced care planning activities. Mostly around, they had conversations with advanced care planning conversations with the people close to them, and they have thought about their personal values and beliefs. The training, the data shows that after the training, the peer facilitators gained more knowledge related to advanced care planning. 92% of the trainees scored 5 out of 6 or 6 out of 6 on the ACP knowledge test that was part of the post-training sessions. And as you see here, that this is there's a significant increase in the individual, in the number of the people who reported increased knowledge after the training in the specific questions related to the ACP knowledge. Also, after the training, the peer facilitators reported significant improvement in their skills and ability to facilitate the ACP sessions. We saw that 94% increase in the number of the facilitators or the trained volunteers who reported increase in their ability to, that the training increased their ability to do advanced care planning sessions. And now they have the required facilitation skills to do that. 90% of the peer facilitators, they said that they are satisfied with the training, and they agreed that the training met their training needs. This graph here shows that their satisfaction with specific elements of the training curriculum. In the research, we looked at the volunteers' experience with the facilitation of the ACP session. We asked them how they felt running the sessions, what worked and what needs to be improved. And we also asked them what marketing strategies or messaging they used to encourage the older adults to come to the sessions. This is a representative quote from a focus group held with peer facilitators about 6 months after they started facilitating the sessions in their local communities. That was the most powerful piece of all of this. Stories, stories, and stories. Because they are real, they happen to real people, and immediately I can identify. So this was not an isolated sentiment. The peer facilitators really embraced their role in boosting the awareness and the engagement of advanced care planning. And they felt that the session structures capture the heart of the public participants. About the data, I'll share with you some data from the public participant questionnaires about their engagement and gaining knowledge. As you said, 266 public participants attended the sessions and 217 completed the questionnaires. The participants were mostly healthy females, and their average age is 65 years old. At the end of the session, 95% of the participants reported increased knowledge of advanced care planning concept and the process. And also in this graph, it shows the level of agreement with that the session increased their knowledge in each aspect of the advanced care planning process. When we asked them about their plan to engage in advanced care planning after the session, 9 out of 10 reported that they plan to think about their personal values and beliefs and wishes. And also 9 out of 10 intended to talk about or share their wishes with their families or friends and healthcare providers. And 7 out of 10, they said that they plan to create an advanced care planning document. More than 95% of the public participants they said that they are satisfied with the session and would recommend it to others. As you see in this slide, the analysis of the ACP engagement data that we collected from the public, the participants at 4 to 6 weeks compared to the pre-session data, it shows that the peer facilitated sessions are effective in sustaining the engagement in the public in advanced care planning. At 4 to 6 weeks, there's 70, we found, or the data shows 70 to 76% increase in the number of participants who created an advanced care plan or engaged in a conversation with family, a friend, or a healthcare provider. This is the experience of one of the public participants in these sessions. One gentleman published an article in the local newspaper about his experience in attending an advanced care planning session in his community. He explained he explained that how he came in with some misconceptions as well, and it was nice to see how it unfolded for him. And then he was very encouraging for everybody to else to do the right thing and attend the session so they can do the right thing for their loved ones. The system experience, this is, we came to know this from the organizations. One of the organizations told us that the doctors, one of the doctors in their community told them that now they have more people coming in their appointments with their advanced care plan in hand, wanting to discuss it and having it put on their file. So that was not part of the research, but we came to know that from the community organizations. Now I will just give you a quick, let's have a quick glance at the impact on the community organizations who decided to adopt this model. They reported that the model raised their organizational profile, and it gave them a new face, a new reputation in their community, and many won awards, and they started to be called to do advanced care planning sessions, for example, in other community centers or in the family practice clinic in the community, or a regular, we're invited to have a regular spot on advanced care planning in their local radio station. They also reported improved connections with people, with sponsors, with other community organizations and healthcare facilities. They developed new partnerships that they believe that it will enable them to sustain the program. The model, what we heard from the interviews with some of the organizations is that the model gave new energy to struggling hospice societies who were really experiencing real challenges in maintaining their existence and continue providing services to the people in their community. We learned from the research and from the experience of the community organizations that there are key success factors to ensure the visibility and the sustainability of this model. Some factors are related to the organizations and others related to the peer facilitators. The organization factors, basically, the leadership support is very important. Having a vision to develop a program for advanced care planning. It's not just like testing or piloting the model. You need to have a program and a vision as how you want to help the people in your community. Administrative support was key to host the sessions in an effective way. Also, that includes marketing tips and resources and advice. Establishing community partnership is also key to ensure the sustainability of these programs. The organization they will not be able to deliver this alone, so they need others to partner with them. For the peer facilitators, key criteria were identified from the focus groups. The peer facilitators, they need to have a passion for the advanced care planning, and they have to be comfortable discussing this topic with the public and be ready to answer questions that might be difficult to answer, and they know how to deal with these questions. They have to also, they need to be willing to get more information, to get information out to the people who need it. And having experience in public speaking and facilitations were identified as key success factors or elements for the peer facilitators. Regarding the spread, to date we have, or so far, the model has been adopted by 22 community organizations throughout BC, and this is again through the BC Center, the BC Center for Palliative Care Seed Grants Program. More than 100 community volunteers were trained to be peer facilitators for advanced care planning sessions. More than 70 public sessions were delivered to date. More than 1,000 public participants attended these sessions in various communities, and we do revisions of the toolkits and the resources always based on the evaluation results that we get from all these sessions. So even though the research project has completed, we at the center, we require all the projects that we support and fund that they provide evaluation data. That's basically a subset of the measures or the data that were collected from through the research project. And at the moment, we have a work underway to translate the toolkit and the model to other languages. Specifically, we will start with the South Asian and Chinese languages. And that's it. Thank you so much for listening, and I think now we are ready to answer any questions.
Thank you both, Doris and Iman, for sharing your work and your results today. I really noticed that it was good to see that the participants were satisfied and would recommend this, and that the community impact was very positive as well. So I guess for now, we will now open for questions to the audience. And just to let everyone know to please continue to send us your questions, and we'll try to answer as many as possible before the end of the webinar. And if you see on the screen, both Doris and Iman have provided an email address if you don't get to your question, or if you think of a question afterwards. So the first question that came is, they noticed that this was done mostly in hospices. What other types of organizations participated?
Well, I'll start to answer, and then Iman can give the specifics. So certainly we started with hospice societies, partly because they'd already, as a provincial organization, identified advanced care planning as one of their key strategic priorities. There was a readiness to engage, and they were familiar, we were familiar with them and they with us around this work. But certainly the intent has always been to spread it to other community-based organizations. So we had 3 cycles of our seed grant funding, and in the 3rd cycle, we opened it up to any community organization that was providing services to people with serious illness. And so at that time, we had different ones sign up, like neighborhood houses, senior centers, Huntington Society, so various groups that could see the value of this for the populations that they were serving. Iman may have the numbers around what percentage of not hospice versus non-hospice, but certainly we're in the early stages of kind of spreading this. And we have also, I think Iman forgot to mention, what happened out of the workshop was that some people identified that you needed almost like an icebreaker before the session. So we've developed and are spreading a conversation game throughout British Columbia. That's had great uptake. And then some hospice societies have also gone on to develop a part 2 workshop where it's not just a general sort of more education awareness oriented session, but where people can come back and actually get help completing their advanced care plan, because as you may know, once you're wanting to document, then there's all sorts of legal issues and things that come into play. And so people sometimes just wanted support around that. So we've also developed, as I said, sort of more of an icebreaker, a conversation game, that deals with advanced care planning topics, but in a much more non-threatening way, and then the workshop, and then a part 2 more intensive, let's get some documentation support happening. So there's a number of different ways that communities have engaged in this, and so, but yeah, it's more than just hospice societies, certainly at this point.
Yes, that's right. Thank you, Doris. And in terms of for the percentage, it's 60% hospice societies and 40% other community organizations.
Yeah, great. And so since it seems to be so successful in BC in terms of spreading, is there any intention to spread this to other provinces across Canada, or is it too early?
This is Doris again. So I know that similar projects are underway in Nova Scotia, where interestingly enough, they partnered with the Retired Teachers Federation. So people who are skilled at facilitation and being in front of an audience and then giving them content around advanced care planning. Ottawa, the hospice organization there, has also been very successful at spreading these workshops in their community. Certainly, I think we would be prepared to answer any questions that anyone else would have in terms of spreading this in their jurisdiction. The specifics of the advanced care planning legislation and the how to document in a way that can inform decision making in a healthcare system would vary province by province. So there would have to be some adaptations, etc., for the specific content. But in terms of awareness and just getting people aware of the why and the kind of the what, would be fairly generalizable, but some of the specifics around, you know, is it a representation agreement like it is in British Columbia, or is it appointing a proxy or a substitute decision maker or personal health? You know, it's different in every province. So those specifics would have to be done locally or within a province.
Yeah, that always seems to be the barrier that we've noticed to date, is the legal aspect of it. But I like, you know, the creating awareness and all of that goes around that's necessary as well. Another question comes up here is, participants in hospice organizations are hospice patients or more of a family member? And ACP in hospice seems a bit late. I think they're just looking for a comment on that one.
Well, this was done by the Hospice Society in a local community, and again, they had local presence and often good relationships to help market this. And so, as I think we mentioned, it was also part of an intention provincially to move away from only being concerned with end of life or grief or bereavement to really being an upstream partner in educating the public about how they could be more engaged in this area. So, and many of them had very, very positive results from kind of partnering in the more upstream education kind of way. So all of them have maintained these sessions even when the funding ended, because it's been such a positive thing to do. That yes, there's work involved, but the benefits far outweigh any of that.
Mm-hmm. And I would like to add to this is that our data shows that I just shared with you is the public participants in the sessions hosted by the hospice societies who were part of the research were mostly healthy females, you know, around the age of 65. So they were not, you know, at the end of their life, or it's not too late. So this shows that the hospice societies or the community organizations who adopted this model basically were successful to reach out to the people before before a health crisis happens or before it's too late.
Yeah, definitely. So when you said that there was no more seed funding available, is that ever going to change, or is that, sounds like somebody here in the audience is interested in getting funding for to engage, and is that ever going to be available again, or?
Well, I think you know, the seed funding was more to sort of start the innovation and spread it. And the experience has been that even without the funding, it's continuing to spread, and more communities are signing on, asking us to come up to their, more remote locations to do training. And so I think this is not something that's dependent on the funding. It certainly helped because at the beginning, these were hospice societies, most of whom had never been involved in a research project before. And so there are, we had 267 participants, 217 of them filled out questionnaires. So someone has to be really encouraging public participants to say, there's some evaluation. We really appreciate it. This will help the research and the knowledge around this. And, so this was a new activity for them, but they all found, again, the benefits outweighed. But if you're just providing the sessions, you wouldn't have as much potentially a burden of filling out questionnaires. And I mean, over 30% of the participants were willing to be contacted 4 to 6 weeks later, and so people were very engaged. But our participants, I looked at the data yesterday, over about 80% had some post-secondary education. So the people that were coming out were by and large, as Iman mentioned, sort of healthy females about age 65, many of whom had post-second, so more educated, aware, wanting to take control a little bit more, either for themselves or sometimes for a family member. So that's some of our spread now, is sort of people who might not have higher levels of education, who may speak other languages other than, and is there different approaches to people who come from a Chinese background? We're talking about these things has a bit more taboos around it, stigma.
Yeah, and I would like to add to this as well that we held a consultation session with all the community organizations that received the seed grants to implement this project, and we asked them about how sustainable this program to be delivered in their community by them, and what other resources that they would require. So all of them basically appreciated a lot the training that's being offered by the BC Centre for Palliative Care to the volunteers. That we are continuing to provide this training until now, and also having the toolkit that includes all these resources for the community, for the organization, for the facilitators, and for the public participants, having them, provided to them with no cost at all. That was really appreciated, and they think that this will help them to continue providing these sessions.
Great. So is the toolkit available to anybody to use it at the moment?
The toolkit is available to the organizations that are interested to develop a program, an advanced care planning education program for the public, and the volunteers, their volunteers have to be trained to complete the training requirements, which is the online as well as the full day workshop. Sharing the toolkit without having these requirements, I don't think would be helpful at all.
Okay, makes sense. Here's a good question: is do you have any suggestions for similar type project for patients with early stages of dementia or mild cognitive impairment?
Well, our current ACP manager worked for a long time with BC Alzheimer's Society, so that's one of the things we're looking at. Is you might, whether or not there's sort of a workshop where maybe someone with early cognitive impairment for whatever reason might attend together with the person who might be making decisions for them, and whether or not we would adapt that in that way. There have been, the BC Alzheimer's Society has been doing a lot of advanced care planning education already for their population, because obviously in that population it's very, very important to plan early before a person may lose decision-making capacity. So we have been working with them around what that would look like.
Okay. Another question is, what is the turnover like for both the facilitators and the participants? I see more so facilitators. Do they, I know this hasn't been around that long, but you find that they're all staying and engaged in this program?
The turnover of the facilitator has been an issue in general, not the volunteer retention, I would say, with hospice societies or with community organization is always an issue. So that's why we required that not only the volunteers are trained from the organizations, but also staff from the organizations attend the training, and they are equipped to be with the resources and the knowledge that enable them to do these sessions as well, to facilitate these sessions.
But that said, both COMOX and Keen, the two sort of organizations we worked with to blend the materials, they've been doing this for more than 5 or I think even up to 10 years now, and their volunteers remain very, very engaged and very, very motivated to continue. So it seems almost like when you get the right volunteers, sometimes this becomes sort of who they are and what they do. Rather than just a sort of a project that was a one-time thing. So
yeah,
they also are very passionate. Some of them are very passionate about this and have like, I think, I don't know if you saw, but in the, you know, in the COMOX volunteers have T-shirts that they wear, you know, it's never too early until it's too late or whatever. And you know, so they've made this a core part of their identity, and then it tends to be maintained.
Okay. Here's the question. Has there been any collaborative work done with the FNHA to bring something like this to their communities? Or does the FNHA have their own plan policies around the use of ACP?
So this question relates to First Nations Health Authority. And we were very fortunate in that a lot of the volunteers who attended our initial training for many of the hospice societies, they have taken this workshop and delivered it in First Nations communities throughout BC. So for instance, Terrace Hospice Society, you wouldn't just do education in Terrace, but they would do education in the community surrounding Terrace and in the First Nations communities. And certainly we have that data, but we didn't pull it out for today. We have been doing education programs with First Nations Health Authority more around the nurses providing care in those communities, because they are often kind of the one-stop shop for all things medical and health related. So many of them are doing our serious illness conversation training, and but we haven't trained volunteers specific for First Nations communities, but the hospice societies that are located in these areas are reaching out. So we had this amazing picture of, I think, the Tofino Hospice Society flying into a boat only or plane only kind of community and delivering these workshops, and been received very well, very receptive, and it would be an interesting demographic to look at in terms of just how do those communities receive this information, and how does that compare to the mostly Caucasian audiences in other communities.
Okay. I think there's a few questions left, but they seem to be overlapping. So I'm wondering, before we leave today, ask both Doris and Iman if you have any final thoughts to share with us before we sign off today.
I was just going to quote Liddy Salno is a researcher that's done a lot of work in compassionate communities and the public health approach to palliative care, and how different that is in a way than providing care just to people at end of life. So really what this project is part of is this larger movement to change societal values and cultures and awareness around end of life, and the ways all of us can be more involved in enabling conversations, and also maybe helping provide care for people at end of life. And what she found in a meta-analysis is that if you make a real difference for real people, and you do something for others based on passion and commitment to make a difference, that both the person who gives the services and the person who receives, they both benefit, and that it always has these ripple effects in terms of organizations and communities. So I would encourage everyone for whom this maybe has been an inspiration to start small with whatever you can do, because if you're doing it with that kind of motivation, it's always a positive thing, and it always has these effects like we've seen on the organizations where suddenly you have new partners and new visibility and new opportunities, and it just has these huge ripple effects. So our project is a small one, but it's very consistent with the literature in this area on initiatives of this type.
Yeah, that's wonderful. And Iman, do you have anything to share?
Or
you're both sharing that?
I would just like to say that at the center we really support and promote innovations, and this is one of the innovative interventions that we are proud of. And this is maybe the audience already knows that this model has been selected as an innovative innovation to address sterility issues by the CFN. So it will be part of the showcase at the conference. And also it was selected last year by the Canadian Foundation for Health Improvement as an innovative palliative care model. So we are very proud of this model, and we are, as Doris said, now we are promoting a conversation game that we also collected data on its effectiveness to stimulate conversations around advanced care planning in a simple, enjoyable, fun way, away from the healthcare settings. So.
And certainly we can let anyone know about the game, because that would be something you could do without special training.
Yeah, and it can be used by in any province, so it doesn't have any reference to the legal requirements of ACP in BC, per se. Thank you.
Okay, thank you. I think that's great. I think this is something at our showcase that really shows true innovation. Excellent work and real impact, and hoping that we can spread this across Canada at some point. But again, thank you for your presentation, and look forward to seeing you at the conference and the Innovation Showcase. If you see on our slide there, you'll see that both Doris and Iman have provided their contact information if you want to send them a question or need some more information about today's session. So I think we've come to the end, and I'd like to thank both the presenters and our audience for their participation, and hope you can attend our showcase. And please register for the vaccination webinar. I think it will be truly informational for everyone, clinicians and citizens, and we're really trying to inform all citizens. So it gives the information that, you can make some decisions going forward. So have a great rest of the day, and that's it for today. Thank you very much.